So I think that's it for me.
Well, thanks, Hannah. So I'll take over. I'm going to be showing the video consultation from desktop. So let me just share my screen. Perfect. So you should be able to see that we've got a dummy patient loaded up here. Mr. Dummy Patient. So the first thing we wanted to show you is that we've added a new template to our chain SMS, which just informs the patient that you'll be contacting them regarding a video consultation either today or tomorrow. It informs the patient not to come in to the practice and when they can expect call and some instructions to follow. And you can amend this as well to say, we will arrange a call for today at 1 p.m. And in the same way that you send a text message, you would just enter the patient's number here. And that will go across to the patient, informing them that their appointment has been cancelled, that they can expect a video call later on today. So in order to start a remote consultation via video, you would connect the video icon over here. And again, you can see this SMS pathway, SMS page is loaded. Enter the patient's number. For the purpose of today, it's going to be Annie. He's going to be our test patient. Enter the patient. In order to carry out the consultation via desktop, you just put NA. If you wanted to contact the patient and use your own mobile number and use your own phone for the consultation, you could put your mobile number in this section here. So we'll just send this across to Annie now. And that message has gone through, and you can see that it saves to the patient consultation. I'll open it up again. If you're using your desktop, you just click the link, the same link that you sent to the patient, and that lets you join the consultation remotely. So we can see here that you can join the meeting, select join meeting. That's me, and that's Annie. There we go. And you can start the remote consultation from there. The nice thing is that this is fully secure and GDPR compliant, and there's no recordings made of the consultation at all. So nothing saves. Bye, Annie. Thanks very much. You can access this via any of your browsers, so via Safari or via Chrome, and it's up-to-date compatible with most desktop services, including Windows 7. I will hand back over to Jacob now. If you have any questions, please get in touch. Thank you.
Great, thank you very much, Satya. So I'm just going to go through some of the questions that have come in over the call. We might have addressed some of them, but I'll just go through all of them to make sure. I'm unsure if I'll be charged roaming charges on my mobile. So if you're using your own phone, best thing to do is connect to a practice Wi-Fi. If you're not, then obviously it will use data. But if it's a UK plan and you're in the UK, then you won't have any roaming charges. I tested sending documents today, but it says download failed. I would suggest contacting our support team there because we haven't hit any of those issues. Electronic signature, best thing to do is visit our support area online, and we've linked to some articles there that some other GPs have helpfully prepared. With regards to fit notes, our understanding is, and we're not advisors on this, but our understanding is that a duplicate fit note doesn't need a signature. And so if you issue a fit note and then issue a duplicate and send that to the patient, they can then pass that on to their employer or to DWP. Documents are stored on our cloud storage, so it's in Microsoft Azure in England. And that's fully compliant with NHS Digital's principles for using cloud services. So we follow what's called the Azure NHS Blueprint. Can you please explain how to do digital signature? We've discussed some nice messages thanking us. So thanks a lot for those. The team do appreciate them, as it's been quite a manic week. The response from patients in System 1 goes to exactly the same place. So it's in the practice inbox. It's not in System 1, it's in the accuRx practice inbox. Once you've reviewed a response, you can then save it into EMIS or into System 1. Just click Save to Record. We've got a question about how patients can get sick note onto their home computer. So once they receive it by SMS, on most phones, it's slightly different on iPhone and Android, but on smartphones, you can share a document once you've got it open on the phone and email it to yourself. If they don't have a smartphone, at the moment, we don't support emailing it directly to the patient, so they would need to either just type that link in directly, or you could email it straight from the practice yourself. Right. Some people are asking about, they're not seeing the video icon. That will most likely be because you're not an approved user. So the accuRx admin within the practice, or there might be several of them, they can approve users. They'll have a notification on their toolbar to approve users. It's fairly likely we'll need to screen a patient twice. If they answer the questionnaire, will they be able to answer it again? So once the questionnaire has been answered, you can send another one. But if it hasn't been answered yet for 7 days, you won't be able to send another. You can copy the link from the previous message and paste it into a new message. The reason we've got that in at the moment is just to prevent, if it's busy and you've got reception team going through loads of appointments, accidentally sending it 4 times to a patient. So, but once they have responded, you will be able to send them a new one. How do we access the practice inbox? So you'll get a notification on the toolbar when you've got any new messages. And once you've dealt with those, as Hannah mentioned, if you just click archive, you'll still be able to access them from the archive, but you'll know that they're dealt with. So you'll only see the things that you need to deal with. The reason we show all messages coming in is that if somebody's away, someone's sick or someone goes away, or only works a few days a week, messages they send can still be seen by colleagues, and someone can check the practice inbox. But you'll only get notified for messages that responses to messages that you send. Any suggestions of how people are using the Ask Question feature? So it's brand new. We've only turned it on for all practices today. If you do have any suggestions, please do send them into the Q&A and I'll read them out. Some examples that we've had are things like GT doctors who've called a patient, the patient hasn't picked up. So they've said, oh, I've got your medication request here. Are you happy? What pharmacy do you want me to send it to, or something like that? Or a GT doctor who speaks to a worried parent with a sick child, who says, give them some Calpol, I'll send you a message, and can you let me know their temperature in an hour? Also being used in the shift to video, so to message patients and say, would you be happy to do your consultation over video instead of coming in? So practice is really innovating there, and do please send us some please send us some use cases. Just reading through the questions. So somebody said they've had difficulty with video consults with patients answering the calls. Some practices, if they've got patients they're more worried about from a technology point of view, the reception have been doing a video call first just to check the technology all works. In our support area, we have got an article saying, I'm a patient, how do I set this up? And just explaining what processes they need to do. But if you've tried it out, you should see it's quite simple. If you don't have the video icon in your toolbar, people asking about that, it's probably because you need to be approved. Some people asking about support for RTFs, so the file type, rich text files being supported. We don't currently support that. We've limited the file types we support for security reasons. We're looking to RTFs and whether we can make that secure. The main limitation there will probably be what do most phones handle, because we don't want to support sending of something that people won't be able to answer on certain phones. Just to reiterate, patients cannot see your mobile number, so we send you an SMS so you've got the link to join the consultation, but there is no way for a patient to see your mobile number, and your mobile number is not stored in their records. We delete it from our servers. It's simply used to get that link onto your phone, particularly because a lot of practices don't have webcams, headsets, or modern internet browsers like Google Chrome. If you're using your own mobile, can you block the number so patient cannot retain? So you don't need to do that because you're not actually calling the patient from your phone. You're joining the consultation from the link. So who picks up charges for SMS? So it depends. If your CCG is paying for SMS messages and you have the enhanced features, so pathways and all of the flories, then your CCG will be paying. If you don't have those, then accuRx is picking up those charges. So what would really help us is if practices, especially with it coming to the end of the financial year, do push their CCGs to fund those SMS messages. It will also mean you get access to a lot more features. Another question, how do we do a video consultation from a mobile? So in that demo, we showed it doing it from a computer. The only difference in doing it from a mobile is instead of in the your mobile number field, instead of putting NA or N/A, you just put in your mobile number and the link will be sent as an SMS to your smartphone. Question about bulk messages. Unfortunately, we don't support that. There are other providers who do that. There's a delay some people have experienced with the SMS coming through to the patient's phone. So that's an issue we saw earlier today with one of our SMS providers. So we've moved all of the SMS traffic for now onto our other SMS provider where we're not seeing a delay. So we try and be as responsible as possible to that. Let me just check if there's any new questions here. Will you be able to access this on a laptop via VPN token? So a lot of practices moving to work remotely. Yes, you will. So if you can access EMIS, you'll be able to access this. If you do have any issues with that, please do speak to our support. It may be because the VPN isn't set up correctly, in which case you'll need to speak to your IT supplier. We do also have a version of patient messaging and video consulting that you can use in your web browser and you can use from home, even if EMIS isn't running. So there'll be more information on that coming out probably in our next email to users, because that's something that's quite new. Someone's asked how to archive a patient's reply when they respond to a message. So in practice inbox, you'll see an archive button. Does the patient accepting video consultation link code as video consultation consent given into their record, or do we need to enter that separately? So and NHSX was quite clear in their information governance on this on Friday. Consent is implied by a patient clicking on the video consultation link, as long as you've been clear in your SMS message. And before they even join the video consultation, it's very clear what's happening. So it walks them through enabling their camera and microphone and then joining the meeting or joining the consultation. So that's where consent is taken. Does the video chat become integrated as a text into the EMIS notes? So if you do see chat come up, I believe that's just if you're on Edge. No, it doesn't. So we do disable chat. It does display on Edge, so we recommend recommend not using it. We're trying to get that fully disabled by a video provider. But from an IG point of view, that chat is deleted after the room is closed. That meeting room, that consultation room is closed. Is there an option to send blood test requests in the same way as sick notes? Yes, there is. So you'll need to make that blood test request into a PDF. So there are lots of products that let you do that. For example, one that I know quite a few practices use is called Qt PDF. And you set that up as a printer on your computer. And then when you print, in inverted commas, the blood test request, you'll be able to then save it somewhere and attach it to an SMS that you send. Can you create a template for sending patients information what they should expect from the video consultation? So we do have some templates saying I'd like to do a consultation over video. So you should be able to just use those, or obviously if there are specific things you want, you can make them. If you can't make some really good templates, please do share with us and we can share with other users. We've had one user ask, how can we use an interpreter, which is a really great question. So that link that you send to the patient can be used by other people. So if you did want to have a consultation with a patient and an interpreter or a family member or another healthcare provider, maybe their carer or district nurse, it's possible to do that. You'll need to send that link to the other healthcare provider. So the easiest way is probably going to be to email it to them, or you could put their mobile number in the SMS field, but you'd then need to click on the link on your computer. But that link that is sent can be used by other people to join that meeting. And can we use accuRx to message pharmacists and district nurses? Not at the moment. We do have a handful of practices testing this functionality. So that is something that will be coming in the future. Right, just going through. Will the inboxes appear on the list as we begin to send messages out? As nothing currently to see. So yes, they will. They'll appear on the left-hand side there. You'll see practice inbox appear. The video consultation is not recorded. A few questions about that. It's not recorded. So simply the data goes between the patient's phone and your phone or computer, but it isn't stored anywhere. So I think that covers all the questions. I'm really sorry if I've missed yours. There were quite a lot of them, and I've tried to race through while still making them clear. If we haven't answered your question, please do message us on our web chat. Some of the slightly more technical ones will get in touch with you directly. So if you ask a more technical question or specific to you, we'll get in touch with you directly. So just want to say thanks again for joining this call. I know you've all got incredibly busy days. Our one big ask will be to share that link at the bottom with your hospital colleagues. So it's been great to see over 500 practices over the last week start using us for who weren't even using us before. But we want to do the same in hospitals and really help them out so that they can move their outpatient clinics online and mental health services online. So we know you've all got communities in your local health network, and if you've had a good experience with our video consultations, please do share that with them. Thanks again for taking the time to join us. If there are other questions or you find another webinar helpful, please do let us know. We'll send a recording out. And we've got lots more kind of features on the way to try and help you out. If there are other things you think we can be doing to help, please let us know. But with that, we'll leave you. So do have a very good afternoon, and thanks for joining.